Right. So this video just explains what to expect before and after radical prostatectomy. When I walked you out after deciding to do the radical prostatectomy, we probably discussed medical clearance. We may have discussed laboratory work, and we probably discussed where the operation would take place. I also gave you the handout to this video. So the prostatectomy will happen um, as an inpatient admission where you do stay overnight in the hospital. You'll come in the morning of the prostatectomy at a given time, and all of kind of the instructions on when you get told what time and everything are on the website under the pre-op checklist. But I always get asked the question, when will I find out the time of surgery? We don't know what time the surgery will be until the evening before, and that's because there's a lot of moving parts to the operating room schedule. We get cancellations last minute all the time. There are also emergencies. Then you have issues with vendors. If there's specialized equipment that needs to come, and the reps from those vendors and their schedule. So there's a lot of moving parts that the operating room staff have to deal with in terms of coming up with a schedule. So they call you the day before with a time. You should have already gone through the clearance, whether it be needing to go to like MD Now to get your clearance done, or to have the cardiologist clear you. A lot of times you don't even need to go for a special appointment. They just kind of already have all that data and they send us the information. But that all should have happened before the day before surgery. Really, all that happens the day before surgery is you get called with your time, and then you do your bowel regimen. And I should have handed you a copy of the bowel regimen. It's basically not a big washout bowel regimen like you're having a colonoscopy. It's a couple of packets of Miralax and a couple of suppositories, or sorry, a couple of enemas, just to kind of clear out things downstairs, and that should be it. So then the day of surgery, you're going to come in and you should be told where to go when you get that phone call the day before surgery. But there's a special entrance at the hospital where you'll come in for like elective surgery. And then you're going to be there probably for 2 or 3 hours. Usually, sometimes it's less than 2 hours, but usually it's a couple of hours before you see me. And then, I'll quickly, and by the time from the time you come in to the time you see me, they're going to get all of your insurance information. They're going to check your blood pressure. They're going to have you change. They're going to get an IV line. They're going to go through all of this paperwork with you and have you sign a bunch of consent forms. Then I come in, I sign my portion of the consent, make sure that the history and physical is up to date, and then, we discuss any questions you may have at that time. After I'm done seeing you, it's usually another half hour to 45 minutes before you roll back. The surgery itself, from the time that you go in the operating room to the time you come out of the operating room, is about 3.5 hours, given the time that it takes for the anesthesiologist to put you to sleep, then the actual like setup, draping and everything, then the actual operation, then undraping, waking you up, putting all the dressings on, blah, blah, blah. The whole thing takes about 3.5 hours. Then you're in the recovery area for 1 to 2 hours before you go up to your room. So say even if you have like a 7:30 a.m. case, you're not going to be up to your room till 2 in the afternoon. If you have a case that's scheduled for 11, you're not going to be up to your room until like 6 at night or something like that. So that's just something to be aware of. This is going to be all day. Just the day, that day's, the surgery day. There's nothing else going to happen that day. And so that surgery is done with the robot. It's done with the small incisions. We use the Da Vinci Xi here, and it's basically 8 millimeter incisions. I will demonstrate. Okay, so there's one incision here, and then there's one incision here, one incision here. Then there's one incision here, one incision here, and then there's one incision here. And so again, they're all small, except this one will have to get enlarged at the end of the surgery just to get the prostate out So if you have a small prostate, that'll be smaller. If you have a big prostate, that'll be bigger. So when you come out of surgery, you'll have these bandages at the left lowermost incision. There will not be just a bandage. There will also be a drain coming out of it. That drain, a lot of times in urology, when we do an operation, we leave a drain because we're doing work on the urinary tract. And if there's, any urine that's escaping the urinary system, we want to get it out with that drain, and we want to monitor with that drain. So we always leave the drain if we're doing like a reconstruction or something like that. And I think we probably talked about this prior, like when I discussed the surgery with you, but 9 times out of 10, you go home the next day. 9 times out of 10, the drain comes out when you go home. 9 times out of 10, the catheter comes out 9 to 10 days later. Any of those things can take longer, but 9 times out of 10, that's how it goes. You have your overnight drain out, go home, catheter out in 9 to 10 days. Any of those things can take longer. So you stay overnight. They'll give you some like soup and broth usually at first. I put you in you can have a diet. So as soon as you're able to tolerate like ginger ale, you can get solid food. We don't really wait on that. Then the next day, I'll come in the morning. I'm actually going to see, as soon as I'm done recording this video, going to see my patient who I did a radical prostatectomy on yesterday. Oh man, it's like the blue screen is all in my glasses. I'll come in, see how you did with food. That's really the main thing that I'm concerned about. Make sure you're not nauseous because you had a belly surgery. Check on the Foley, check on the drain. Then, as long as everything's on the up and up, I'll go ahead and put in the discharge stuff, send pain meds to your pharmacy, and the nurse will show you how to use your Foley bag. The Foley bag is not something that should be intimidating. It's really simple to use. You just drain it into the toilet. You'll get 2 bags. One will be a smaller bag you can strap to your leg for during the day. Another will be a big bag for at night. To change them, you just unplug and plug. Just take it apart and put another one back in. The system at that area where there's a junction, please don't like rub it in dirt, but it's not sterile. So, if you want to put on gloves, that's fine. But otherwise, it's not sterile. You just take it apart, put it back. And then there's a nozzle at the bottom of the bag. You just use that to empty it into the toilet. So, but the nurses will show you how to do all that, but you'll go home with that. That'll be something that you'll have to empty. When you go home, we will send you home in a condition where you're able to walk around the house. You're able to go up a couple flights of stairs. We would not send you directly home if you were not able to do that. It's great if you have someone living with you that can check on you, that can help you, but it's not entirely necessary. When you go home, you should be able to like microwave food, answer the door for DoorDash or whatever. Most men do not drive while there's a catheter in place. Now, there are men who drive with catheters. We use catheters for a lot of different conditions. Some men have catheters for life. That will not be you. And because it's going to be a brand new thing, usually after a prostatectomy, men don't drive with a catheter. Once the catheter comes out, you're totally fine to drive as long as you're not on. The big thing that would prevent you from driving is just being on narcotic pain medicine. Most men don't need narcotic pain medicine really at all after this surgery. But if you do, you cannot drive while you're on narcotic pain medicine. The Foley is not what limits you from driving. You can walk around the neighborhood, but I think we probably talked about no running, jumping, pickleball, golf, motorcycle riding, lifting, tub bath, or swimming for 30 days. So I do want you to walk around the house for sure. If you want to take a short walk in the neighborhood, that's great. The biggest part about surgical recovery is that this is a time to listen to your body. If you have a pain, stop doing what you're doing. This is not a time to set a personal record. And this is even after the 30 days, right? If you're active and you get back to that activity, this is not now, okay, I'm back to going back to my personal record. No, that you should really ramp up slowly, listen to your body. and take it easy because you just had a major surgery. The robot makes it great in terms of pain control, blood loss, quick recovery, and it's also almost a false sense of reassurance. I had a patient, not a prostatectomy, but I had a patient who had a reconstruction of their ureter to their kidney, all gentle stitches. And she went back and started golfing after like 25 days, driving, and she felt a pop. And so everything was fine, but she had some pain after that. I honestly, not sure exactly what happened. The scan was fine, but the point is, not a time to just go straight back into it, ramp up slowly. So usually getting back to the hospitalization, um, I'll see you in the morning, I'll put in your stuff, they'll teach you, and usually you're ready to go mid-morning. Sometimes I may have a little trouble getting up there to see you, and I can't see you until lunch or something like that, and you go home in the afternoon. And so there's a little bit of variability there. But generally it's mid-morning that you go home. And you go home with a catheter. The bandages will come off before you leave the hospital. You can shower the second day after surgery. So the first day after surgery, the bandages come off. Second day after surgery, go ahead and shower. When you shower, don't run the water directly on the incisions. If they get wet, it's fine. It's not anything to freak out about, but make sure that everything gets nice and dry immediately after the shower. You can leave the incisions open to air. I want you to leave the incisions open to air, except for the incision with the drain. That will get pulled before you go to the hospital, and then that will be left open. It'll close. Actually, the healing of it looks pretty much the same as the other incisions, but that will be open, so that will be draining for a few days. So when you go to the shower, take your bandage off. When you get out of the shower, go ahead and put a new bandage on. That bandage can be changed as needed. So if it soaks through, go ahead and change it. Otherwise, you should change it at least every 24 hours. If after 24 hours you go and you take it off and it's totally dry, then you can just leave that one open to air too. And then you can just leave everything open air. I use staples for the incisions. The cosmetic effect actually pretty much is the same as the stitching. I've had patients react to the stitches. And so for this surgery, I don't use those stitches. It also can be an issue if there's any issue with the wound, you don't realize it because there are stitches, and so everything is closed really tight. And so if some part of the wound deeper down is having an issue, you won't know about it until much later, and it can be a problem. So I prefer to just use the staples. And so the staples and the catheter will all get removed when you come back to the clinic. You get a little shot of antibiotic then, and then you'll be good to go. As far as like stuff inside you, staples and catheters. Once the catheter comes out, and I say this in the first video, and I've always said it when we're talking about the procedure, but um, you know, there's a lot of information, and so sometimes this part gets lost. But when the catheter comes out, you are going to need to wear a Depends. Even the best result, I've had patients come back after like a week and they're not having leakage. Okay. I've had that happen many times. But that you're going to need it depends at least for a few days. Usually men need it depends for a couple of months. So it may be worthwhile just to go to BJ's and get the big box. And then you're good to go. And you may not even go through, you probably won't even go through the big box of Depends. You may need a protective pad later on for like when you cough and sneeze and stuff like that. But you definitely are going to need to wear a Depends up front, and that should improve rapidly. We also probably talked about erections. You're almost certainly not going to get erections, especially early on. You should not going to get any erections at all immediately. After several months, it depends on your age. Really, that is the big, even more than a nerve sparing or any of this stuff. The most best predictor of whether or not you're going to get any erections after surgery is your age going into it. So men in their 50s do relatively well. It's better than a 50% chance that you'll get erections. You'll need a Viagra for sure, but you may get erections. Men in their 60s, less so, late 60s. Now you're talking about 25% chance you'll get erections. Men in their 70s probably are not going to get erections after the prostatectomy. And, when you're ready, we can go into the options of the injections or the implant. Both are safe. Everything is covered by insurance because you are a cancer survivor, but that's something to expect. Otherwise, the risk of surgery, now I will give you the risks at the time of our appointment in terms of percentages based on your anatomy and your prior surgical history. But for a guy of average weight and no prior belly surgery with an average prostate size and no medical conditions that prevent wound healing, it would be a 2% risk of significant bleeding, 2% risk of significant infection, 1 to 2% risk of a wound complication, 1% risk of any injury to the bowel or something like that. And those are basically the risks. And so if you have any questions, please call the office, but otherwise I'll see you on the day of surgery. Have a great day.